Martha, is a poverty reduction target going to make it from a campaign pledge into the administration's agenda?
I think there's no question that the president is extremely focused on reducing poverty. And if you look, for example, at the Recovery Act itself, I think had it been enacted in any other period of time, it would have been regarded as a landmark anti-poverty bill. It included significant expansions in unemployment insurance, including eligibility for unemployment insurance to cover part-time workers, more low-wage workers, the significant food stamp increases, TANF emergency funds, the refundable tax credits that will now be more available to working families to help supplement their wages. The list goes on and on. So I think the first thing to say is we're in the middle of doing it. Now it's happening in an economic context in which broader forces are going to make it extremely challenging to see poverty actually come down in the near term. So if you ask the president, what is your goal for reducing poverty? I think the first thing he'd say is let's turn the economy around. And once it's clear what this future economy looks like, what shape we're in coming out of the recession, it'll be much easier to say, okay, here's a benchmark I'd like to aim towards. Here's the kinds of policy changes we think will be most effective.
Because the new poverty data will be coming out in September, and of course the number is expected to rise from current levels.
Sure.
So aside from turning the economy around, which obviously would be the first step, is there any more specific measure that the president wants to take to end poverty?
Well, there are a number of initiatives in his budget that are aimed at further advances towards the reduction of poverty and the creation of opportunity for people who today don't have it. I think we may talk about the Home Visitation initiative. That's certainly a key element there. Investing in transitional jobs programs, which really have shown some promise in taking people who aren't able to succeed in the workforce and transitioning them into it. A number of different measures sort of in that category. The investments in the child nutrition programs are certainly something we hope to see later this year. So it's not, and in the meantime, the Recovery Act happens over a period of 2 years. Starting on January 1, we're going to have families filing for those expanded refundable tax credits, which I mentioned. So that will be another moment in which we are hopefully helping to lift up a bunch of people who might otherwise have fallen at or near the poverty level.
Martha, can you describe the president's home visiting initiative that was included in his budget and fill us in on the reasons it's a priority?
Sure. The home visiting initiative is something that really captured the president's imagination during the campaign. It's a program that's been tried in different formulations, most promisingly through something called the Nurse-Family Partnership, which has been rigorously evaluated and shown that it really has tremendous impacts on reductions in abuse and neglect, hospitalizations of children, can improve their educational outcomes, and so on. And the basic idea is to have a trained professional like a nurse come visit a low-income parent's home regularly during a pregnancy and then in the first few years after a child is born, to help that parent understand all of the how to care for a child, how to care for a child properly, start thinking about that child's educational opportunities and the parent's own life chances and employment options for her or for him, and really sort of help see this as a moment to help that child get on the right track and also the parent too in life.
Well, is this sort of an expansion of the already existing social services networks that are in place now?
In some cases, various states have funded home visiting initiatives, and they've done it different ways. But the idea is, yes, it's part of a layer of social services available to people, but this would be a significant investment in a certain group of particularly vulnerable families at a moment in their life when they most need this kind of intensive service. And it's all in a supportive way. Whereas I think a lot of other social service interventions only happen when there is a problem. This is preventative, helping people get on the right track and stay on the right track.
And the administration has emphasized the importance of these being high-quality, evidence-based home visitation programs. Why is that?
I think particularly in an era of deficits, but frankly at any time, it's the government's responsibility to make sure that we're investing in what works and not in what doesn't. And there is some really promising, as I mentioned, evidence to suggest that home visiting programs, if carefully crafted, can have significant impacts on child outcomes and can even reduce health care costs. There were reductions in Medicaid costs associated with some of the home visiting because you had again, various outcomes, reduced hospitalizations, sometimes the delay in having another child, some of those very concrete outcomes as a result of these home visits. So if we can do it right and stick faithfully to what we think the evidence shows, although we're interested in funding options that aren't yet proven, sort of promising strategies and evaluating them carefully, and if they work, folding them into part of what we support going forward.
Do you envision helping states evaluate these programs?
I think some of those details are still to be sorted out. We certainly have a very strong research and evaluation team at the Department of Health and Human Services who stand ready to provide that kind of support, but that's something, the details of which we'll work out with Congress and with the states.
How vital is it, Martha, that in addition to being skilled in delivering needed services directly to families, that the home visitors also have skills to refer these families to other community services that are available to them?
That's really important. A home visitor is one element in a person's life, but if you uncover substance abuse problems or domestic violence or a need for job training or career counseling, there are many other services that are probably beyond the scope of that individual home visitor to provide. And providing those referrals is absolutely critical. I think the best programs will stitch that very closely together.
Martha, over the past 12 years, there's been an increasing shift toward helping families by tying government supports to work, which help lift families out of poverty, even if the jobs are low wage. For example, the Earned Income Tax Credit is a big help if you have a job. But given the prospect of high unemployment and possibly continuing for years, actually after the economy does turn around, is there a need to provide a safety net that is not conditioned on being able to find a job in the private sector?
I think we do have certain elements of the safety net that aren't conditioned on work and that were boosted in the Recovery Act. The food stamp program, in particular, the element of the food stamp program that in ordinary times requires adults without children to be involved in work. There was a waiver of that provision for this very difficult economic period of time. The TANF program doesn't require private sector employment, that's the goal of it, but in order to receive assistance from the TANF program, that it's not conditioned on that. And certain kinds of housing assistance. There are many rich elements of our safety net that don't particularly say it's only if you have a work. It's not just the unemployment insurance model. Now, I think we take this a year or 6 months at a time and see if we do have a longer than we hope period of unemployment. It's certainly one would want to revisit whether our safety net is doing an adequate enough job catching people going through that period of time. We certainly know today it's not performing as well as we'd like it to. But I think before one passes judgment and says we're out of a world where supports related to work are really the key to reducing poverty, we just have to see how this crisis unfolds and how we move ourselves through it.
We earlier interviewed Mike Gerson, who had worked with the Bush administration and faith-based initiatives, and he said that he felt President Obama was continuing many of the good works in that effort that President Bush had started. Do you see evidence of that, or is that increasing?
I do. I think we took the best of what that was and really did continue it. I have a colleague, Joshua Dubois, who heads the Office of Faith-Based and Neighborhood Partnerships, whose role it really is to make sure the President and the White House are connected to faith-based organizations and other community organizations so that we hear their ideas, we hear what their communities are experiencing, and that gets folded back into our policy-making process. And we've had many very good discussions with those groups about poverty issues in particular, which are of concern to so many faith-based organizations.
Martha, how can we help people watching this interview make sure that poverty stays on the front line of our lawmakers and in the eyes of the public?
I think certainly telling the stories of people and what they're going through and making sure that as we talk about what an economy as we come out of this recession looks like, making sure that the needs of those who today have low skills or are facing mental health barriers or other kinds of barriers to employment or barriers to success in life, whether or not that's employment related, making sure that really comes out and that what policymakers hear are about that group of people as well as those who are perhaps more temporarily dislocated but will bounce back once the economy bounces back. We just need to continue to hear that input, as does Congress.
Okay. Martha Coven, thanks for joining us on Spotlight.
Thanks for having me.